Hey guys, what's going on? Welcome back to my channel. I hope everybody had an awesome holiday season and is ready for the new year. This video is going to be posted this weekend, so it's going to be after New Year's. I'm recording it on New Year's Eve, so Happy New Year to everybody that's watching. And I hope that 2021 is a lot less crazy than 2020, although there's so much to be grateful for in 2020. So it wasn't all in all a horrible year. I learned to slow down a lot, to just really value my family and the time that I get to spend with my kids and all that stuff, even though it was crazy homeschooling and all that jazz. So there was a lot of stressful things, but I also learned a lot this year. So I hope 2021 goes a lot smoother, but I'm grateful for all the lessons that 2020 held for me. So I hope you guys are too. Okay, so if you guys are new to my channel, and this is the first time you're here, my name is Brittany, and I have been in a wheelchair for 21 years this December. I make videos all about living life in a wheelchair, and I want to make your life in a wheelchair happier, healthier, and easier. My videos are all about tips and tricks that I found over the years to make life in a wheelchair easier. I'm also going to be doing lots of videos on how to stay healthy in a wheelchair, how to eat healthy, how to stay fit, how to reduce pain, how to use food as medicine, how to use herbal treatments instead of pharmaceuticals. So there'll be a whole bunch of new stuff coming out this year. I'm really excited for it. So stay tuned for that. But today's video is all about pregnancy in the second trimester with a disability, specifically with a spinal cord injury, because that's the experience that I have. When I first became pregnant, I had an unplanned pregnancy, so I don't recommend that. I was in the middle of university. If you watch my intro video, you'll know that. There was zero information on the internet back then because it was in 2008. I just had no idea what to expect. I didn't know, if a pregnancy was going to be harder on me because I had a spinal cord injury. I didn't know if I could have a natural birth. I didn't know anything. So it was really just kind of a trial and error for me and working with my doctor to figure out what worked. And so I'm making this video series so that nobody else has to go through that. And thankfully, there are so many more resources out there now for women with disabilities and spinal cord injuries regarding pregnancy. So it's a lot easier, I think, to find the information, but it's still really scary. So it's nice to hear from somebody that's actually gone through it, that has a spinal cord injury, and not from a doctor that doesn't know exactly what you're going through. So I'm hoping that this video series will help you if you are pregnant or thinking about getting pregnant, help you navigate the whole process. That was a long-winded way to explain what this video is about. So let's get into it and talk about all of the different things that can happen with a spinal cord injury, or that you should worry about, or that you should be thinking about in the second trimester of pregnancy. So the first one I want to talk about is bladder management. And there are a number of things that make bladder management more difficult once you start getting into the second trimester. I talked about UTIs in the first video, so you might already be dealing with a higher frequency of those in your first trimester, which will continue in your second trimester most likely. And so you will want to be drinking more to prevent UTIs. And so you'll be drinking a higher volume of liquid, and on top of that, your blood volume increases significantly when you're pregnant. So there's just a higher volume of fluid circulating in your body. So with the extra drinking that you're doing to prevent UTIs and the higher blood volume, urine output is going to be higher. And on top of all of that, the baby is getting bigger and putting more pressure on your bladder. So more urine and more pressure on your bladder means naturally that your bladder management changes with all of those concerns. You might have to increase the amount that you cath. You might have to start wearing poise pads because you might be leaking more. You might have to even wear a Depends if it gets too annoying. And some people even have to resort to putting a Foley catheter in if it gets too crazy. I didn't have to do that, and most of the people that I am friends with that have had children didn't have to do that either. They just had to increase how much they cath, or sometimes wear like a Depends or a pull-up or something like that through the pregnancy, just so that they weren't constantly changing their clothes if they did leak because of the pressure on their bladder. And even though I did talk about UTIs in the first video, I want to reiterate that they are a risk factor for preterm labor, so they need to be managed well. So if you are getting chronic UTIs during your pregnancy, you need to make sure you and your doctor are managing that properly. And a lot of people even have to go on a low-dose antibiotic throughout the entire pregnancy just to prevent UTIs. I didn't do that, and I actually went into labor with my daughter early, and I think that it had a lot to do with the chronic UTIs that I was experiencing in my second pregnancy. So it's really important that you're taking steps to prevent UTIs and working with your doctor to make that happen, and getting them treated really quickly if one does occur. The second one I want to talk about is bowel management. The hormone progesterone causes all of the smooth muscles in your body to relax, including your intestines. And this causes slower bowel motility and slower digestion, which in turn causes constipation. And this is just a normal thing in pregnancy with all women. And because spinal cord injury reduces bowel motility and increases transit time anyway, it just makes the problem worse. So you may have to change your diet and increase your insoluble fiber, which helps increase bowel transit time and create bulk in your bowel. Or if that doesn't work and you can't manage it with diet, you may have to take either some natural supplements or pharmaceutical supplements that will help you stay regular during your pregnancy. Okay, number 3 is faintness and dizziness. So I already talked about how progesterone relaxes the smooth muscles in your body. It also relaxes the walls of your veins. And that, coupled with the pressure that the uterus puts on the veins in your lower body, means that the blood is returning to your heart more slowly, which can cause lower blood pressure. A lot of women with spinal cord injuries already have low blood pressure, and so it can just cause dizziness and faintness, especially when you're sitting up. I know in my first pregnancy, this was a huge problem for me, and it probably was worse because I laid down all the time because I was dizzy and didn't give my body a chance to kind of adjust, but I was always dizzy. Number 4, and this is sort of related to the first two. So the progesterone is relaxing all of those smooth muscles, including the walls of your veins, which means that the blood in your legs is taking a longer time to travel back up to your heart, and the longer the blood stays in your legs, the more time that the fluid that's in your veins, which is already increased with pregnancy because your blood volume is up, has more time to escape into the interstitial spaces in between your cells. And so that just causes more swelling in your legs. It's something to consider when you think about, wearing shoes and how tight they might be, or how often you're elevating your legs, that kind of thing. Shouldn't be insanely bothersome, but it's something to watch for and just pay attention to, especially when you're choosing clothes and things like that that might be tighter because you have increased swelling. The last one is autonomic dysreflexia, and this primarily pertains to people with injury levels T6 and above, but it has been documented with women with spinal cord injuries at lower levels. So don't just assume that if you're below T6 that you're not going to get autonomic dysreflexia with your pregnancies, especially in the second trimester. With all of the previous issues that we talked about, autonomic dysreflexia can be triggered just from higher amounts of bladder spasms or UTIs or constipation or swelling in your feet that's causing pain. Any of those things can cause uncomfortable stimuli below your level of injury and trigger autonomic dysreflexia. Not to mention, your body is just becoming more uncomfortable and the baby's starting to kick, all of those things. So always be monitoring your blood pressure to see what level it's at. If you feel like you are having autonomic dysreflexia, make sure that you are managing your symptoms and always trying to remove or figure out what the stimulus is that's causing the autonomic dysreflexia so that it's not causing dangerous symptoms for you or your baby. Okay, so that's it for my take on all of the things that you need to watch for in your second trimester. There are a whole bunch of great resources online, and I will link to those in the description below. I'm also going to put all of the information that I talked about in this video in a blog post, as well as all the information that I talked about in the first video. and all of the information that I'm going to talk about in the other videos in the series as well. As always, guys, if you have any questions about anything that I've talked about in this video, please leave them in the comments. I love interacting with you guys down there and getting to know you guys all better. If you thought this video was helpful, please hit that like button and consider subscribing. And if you know somebody that this video would be helpful to, please share it with them. Thanks so much for watching, guys, and I will see you in the third part of the series real soon. Bye.